Hi guys, I'm Dr. Richa Malhan. I'm a gynecologist and I'm currently working in a civil hospital, Sonipat. This is a government hospital, so I work for the public and there is no private interest in my mind ever. So I understand a lot of you have issues as to we want a normal delivery, but these days everywhere we go, a cesarean is done. So I'm here to help you people understand why a normal delivery is good for you and that it is very much possible. There are a lot of factors which decide why most women go for cesarean and not normal deliveries, and how you can prepare yourself for labor. We'll discuss it all over here. If you want more information from me, as in a doctor's point of view, why a normal delivery is better, and more elaborate tips and a long session on why you should want a normal delivery and you can prepare for it yourself and speak to your gynecologist in advance, so there's a greater chance of you ending up into a normal vaginal delivery, please follow my Instagram channel. It is called Modern Janani. I'm also a mother. My baby is 13 months old only. And, when I was on my maternity leaves, it was at that period that I decided that, I should use my time in a better way. And, I understood the pain of a mother, the problems a mother has. And I decided to create this page for all the fellow mothers. And I give all kinds of necessary medical advice needed. I would love for you all to come to my channel on Instagram called Modern Janani. You can also follow me on YouTube. There's some videos over there also, but I'm very, very active on Instagram. You can directly message me and ask me your doubts. And we usually have live sessions on Sundays where I will be clearing all your doubts over there. So I hope most of you are going to see me there. Let's begin with your questions now. Anything you want to ask me about how you need to prepare for normal delivery, I am going to help you right now, and later I will tell you my further tips. So one of you is asking, does breathing exercise help you during labor, and when should I start with them? Definitely breathing exercise help you with labor. So when you're in labor, you can't control much. The pains are going to come and they're going to increase in intensity minute after minute. So what you can be doing is just keep yourself a little calm and help for the natural process to happen so that the baby slips down faster. How you'll be able to do that? You have to maintain patience, you have to remain calm, and meditation and breathing exercise help you. It is very difficult to do the right kind of breathing, right kind of meditation at once when you're in labor. So you begin in your pregnancy itself, preferably first trimester. If not, then in the third trimester, that is 6 to 9 months period, that is the time you need to start breathing. There are several techniques. One is simple breathing. This is the easiest. So you take a deep breath inside and then you leave it out. There's another method in which you can follow a pattern. So your mind focuses on getting about that pattern. For example, there's a method of breathing which is called Lemay's method. There's another method called Bradley method. There are many more, but these are the most popular methods. So for example, in Lemay's method, what you do is you follow a breathing pattern which is called hu ha ha, hu ha ha. Okay, sounds funny, but please play along with me and you will get it. So when you breathe like this, when you take a small breath and then a deeper breath and then you leave it in two further processes like this, like in two steps, what happens is that your mind is completely focused into doing this breathing pattern and you are less focused on the pain that is happening down, on the chaos that is there in the room when you are delivering. So this definitely helps a lot of women, and because they keep practicing it every day in their pregnancy, on the day of labor, all they have to think about is this breathing pattern. They just put this pattern on their mind and keep following this pattern and listen to nothing else. And trust me, we don't even have to ask them to push. And the active stage of labor, where the pains are very high, it just passes like a breeze. So you can definitely practice these sessions. There are also a lot of programs which you can subscribe to, and they teach you these breathing pattern practices, just like yoga classes and all. You can always buy subscription and all. So Lame's and Bradley breathing patterns, there are subscriptions available online. You can even go for them, or you can do it by yourself. There are enough videos on YouTube to help you get the method very easily, and the delivery process will be easy. Anything else that I can help you with? You can ask your questions down there. So somebody is asking, I had to undergo a C-section in my previous pregnancy as I got tired during delivery. How can I avoid this and increase my stamina? Hmm. So this also happens that when you are in labor, you can get very, very tired. This is why I've asked you to exercise breathing. So breathing helps. The another thing is exercising. You should have a good stamina. It is important. It helps you to deliver the baby conveniently when you want to deliver normally. So for that, what you can do is, if you've been exercising pre-pregnancy, please continue to do the same exercises in your pregnancy. Pregnancy does not mean that you need to rest all the time unless you have a specific medical condition. If the doctor tells you there is some kind of complication in your pregnancy, then you have to listen to the doctor. But in case there is no complication in your pregnancy, then please do not avoid exercises. Whatever exercises you were doing pre-pregnancy, what it was running, it was swimming, it was Pilates, you can continue to do those exercises. In fact, it will be helpful to you. So it is a big, big myth that exists that if you're pregnant, you need to stop exercising. No, you don't have to increase your exercises, but you will continue to do the exercises that you were doing before. So I hope that's clear to everybody. Also, there are women who were not exercising before pregnancy. What about them? You should still do 20 to 30 minutes of moderate intensity exercises. What I mean by moderate intensity is walking, brisk walking, not walking like, okay, you're strolling in the park. No, you need to really walk so that you sweat it out a little bit. But you have to obviously make sure that you're wearing comfortable shoes, you're in a plain position, plain surface, so that you don't trip and all. Falling is dangerous for sure. So you need to be in a safe environment, but you have to exercise. 20 to 30 minutes of brisk walking does wonders. It keeps your hypertension and diabetes away from pregnancy. Do you know women who don't have diabetes and hypertension also get it when they're pregnant? So please take care of that. Also, in case you want me to talk in Hindi, I can definitely do that. I'm more comfortable in English, but in case more people out of you want me to start talking in Hindi, हम हिंदी में भी बात कर सकते हैं. It's not a problem. So next question is, are there any dietary changes that can support me when preparing for labor? Yes, definitely. So I think an Indian diet is very good. You don't need to start different kind of diet in your pregnancy. We are Indians. We have every place, if we are living close to the ocean, we are more on seafood. If we are living on the mountains, there's different kind of food. And all these food are local food which are good for that place, that climate, that region. So please continue to have the normal Indian diet that you are having, but you have to increase one, the protein in your diet. Okay, so whatever protein you are having, you have to increase it. If you are a non-vegetarian, very good, please start having at least 2 to 3 boiled eggs in your pregnancy. The egg white is very good source of protein. If not, if you're a vegetarian, please increase your intake of green vegetables and dal. Okay. Other than this, soya bean is a very good source of protein. So is paneer. If not paneer, you can have tofu. And also gur and chana, very very good. If it's winters, just stock up on sag. Okay, have so much sag, it also remains as a reserve. It gives you so much iron and protein both, that it will also remain a reserve for later use. But beyond this, do not stop having your iron and calcium supplements. They are extra. That is an extra requirement of pregnancy. No matter how good your diet is, that iron and calcium supplements and folic acid in the first 3 months, that has to be there. After that, please increase the protein and the iron that you're having in your regular diet. Okay. So, what exercises will help me for labor in the last trimester? So, in the last trimester, you don't have to do any special exercises. Like I said, one, continue the same exercises you were doing pre pregnancy. Second, if you were not exercising, please start doing 20 to 30 minutes of brisk walking, and you can start yoga. Yoga is very safe. I prefer advising yoga over other forms of exercises, because yoga does not increase your heart rate very fast. Anyway, your heart rate is very fast in pregnancy, because whatever your uh, heart used to pump, whatever blood it used to pump, normally we have 5 to 6 liters of blood in our body. In pregnancy, it doubles. So the heart is already under pressure. Now if you do a very very strenuous exercise, it gets very very troubled. So you don't have to do very very strenuous exercise unless you're used to it from before. So moderate exercise is good. And if you do yoga, what it does is, it does not suddenly increase load on your heart. They're mostly stretching exercises, and they slowly induce you, slowly increase the pressure on your heart, which your heart can take, which is good for it, but not too much. So you can do yoga exercises. There are plenty of videos on YouTube. If you visit my channel, Modern Janani, Janani, Janani means mother. So on this channel, I have posted my own videos and photos also, what I was exercising during my own pregnancy. So you can do the cat and dog pose, which is that you become like a cat or an animal, like you're on your all fours, and then you push yourself up and then down, up and then down. So you need to do this exercise. Then you can always put your hand around your waist and then rotate yourself in all directions. That is a good exercise. You need to do all kinds of stretching, so be it like this or the other way around, or bending down and then going behind. That you can do as much as your body is allowing. Never push yourself too much. If you keep doing stretching exercises all your pregnancy, there are a lot of ligament pains that happen. Suddenly you have backache, and suddenly you have pain on one side of the groin. Okay, just above the thigh, on the lower side of the abdomen, there's a round ligament pain. I suffered from it. It was terrible. So if you do stretching exercises, these pain will not come to you. Okay. So, what a woman needs to carry before going to labor? Well, I have a video on YouTube in which I've shown my own delivery bag to you guys. Please follow Modern Janani, and you will see this whole bag in which there's so many things. Individually, I've shown everything that I was carrying. See, you need clothes. You need at least 2 to 3 pairs of clothes for yourself, clothes for the baby, towel for the baby, toiletries for yourself, random things that you generally pack when you're going for a 2 day trip or a holiday. You need your toiletries and clothes and everything that other than that, don't forget to keep like the file of your delivery. Sometimes, when you're in labor, you suddenly rush to the hospital and forget all your papers behind. All ultrasound report, all the papers, they need to be kept in one packet. Buy a folder and put all the papers in one big folder, so that they're not here and there. In labor, you kind of rush, and then everything spills. Okay, so to prevent that, keep them in a folder, and that folder has to be in your delivery bag. If you keep that bag maintained, when you're in ninth month, make this travel bag, and it should be ready at all times. When you have labor, and anybody in your family should know that one bag has to be picked up. That's all. So in that bag itself, there has to be the papers bag. Other than this, I would say that there is a special bottle which is called the Peri bottle, Peri, Peri bottle. You can find it on Amazon. So it has like a straw kind of thing which is tilted. So there's this one regular straw which is straight, there's one straw which is straight and then tilted. So this helps you clean down below after delivery, so you have stitches and all. So this bottle will not give extra pressure on your stitches in your vagina, and it will also help you clean yourself, feel much clean. You're going to bleed after delivery, okay, for a few days, almost 7 days there's going to be bleeding, heavier on 2 days and then it gets lighter. So you need to keep yourself clean, so you need to wash yourself also. Sometimes you need to apply ointments and betadine and everything down there on your stitches. So this bottle is going to help you. Or every time you go to the washroom you will feel a little yucky, so you need to clean yourself. Peri bottle is very, very helpful. You can also buy something called nipple shield. Okay, this is like a transparent plastic thing which you put on your breast in case your breast becomes very sore. If then you can always put a nipple shield on top and then start the baby on breastfeeding. Second thing, you can buy a nipple cream, any body butter cream, nipple cream from any brand, it doesn't matter. But if you buy a nipple cream, Nip Care is the most common brand that is available in most of the shops. So if you buy that, if your breast, they become swollen, you're feeding every 2 hours and it takes a toll on you. So if you put this cream on your breast, it will help you soothen up, it will ease you up. Always carry an extra blanket, because after, in case you land up in a cesarean, suddenly you will feel very, very cold. It is a normal side effect of the anesthesia that is being given in a cesarean, so you can always use that extra blanket, it comes to rescue. A baby nail cutter, because babies nails, they grow up in 3 days, every 3 4 days you have to cut them, it is so annoying. So in case you have a longer hospital stay, it'll be handy. I think that's about it. Rest, you watch my video on modern Janani, either Instagram or YouTube, preferably Instagram. You have more details there. Okay, butterfly exercise, definitely. Yes, it's a very good thing. Butterfly exercises you can do in your pregnancy. Some people also, old people and people in villages, they used to recommend that you should do pocha in your last trimester. I'm sure you've heard that, no? So when you do pocha, what happens is basically you're stretching the thigh muscles. So two myths that are there. A lot of people feel that these exercises should not be done. It's not true. When you ekdam at your brim, no, you've completed 37 weeks, your delivery date is only 2 3 weeks away. If you start doing these exercises that stretch your thighs, they help to open up the vaginal canal a little better. And even sex in the last trimester, when you're just very close to delivering, is not bad, it actually benefits you. Sex and even nipple stimulation, if your husband or you yourself stimulate your nipple a little much during, in the last few days, it helps you to get into labor faster. It's a doctor's secret. Not everybody knows it, but these are medically proven facts. Okay, any takeaway message for women to get so that they're not scared of the word labor? See, you don't have to be scared of labor. Why? Because it's nature's way of delivery. I always say, कुदरत का कमाल हम कभी नहीं समझ सकते. कुदरत ने हर एक चीज इतनी सुंदर बनाई है, चाहे वो एक चिड़िया है, चाहे वो एक फूल है, और भगवान ने हर चीज बहुत अच्छे से प्लान की हुई है. So the natural way he wants you to deliver is normal. Even if there's no doctor, even if there is no, in villages there's sometimes no dye also, still those women deliver. How? And they deliver vaginally and beautifully. Why? Because nature helps you in delivery, and it is going to happen. What a doctor does in a normal delivery is just he stands there and assists you, he just helps you. Okay, and in case, god forbid, there is something going wrong, sometimes things go wrong and your baby is in trouble or you're in trouble, only in those situations, which are 10%, the doctor comes in to change the plan of nature, which is normal delivery. They take you for a cesarean and help you deliver the baby safely, so that the mother and baby are safe. That is the most important thing, that both of you have to be safe. So only then a doctor is needed. Otherwise, God will do his job, and you will always be amazed that just yesterday this baby was inside me and today it's in my hand, and every day he will bring new joy into your life, and every day you will feel, till yesterday my heart was beating inside me and now it's in that baby. How? And it's beautiful, it's amazing, it's adventurous, you're going to love your journey. And when you don't, a doctor is there for your help. Please talk to us. Please, we're your friends, you don't have to be scared. Choose a gynecologist that you can freely talk to, who is friendly with you, who does not judge you. Because if you can't talk to your gynecologist, then the journey gets harder. And every problem in your labor, postpartum, is solvable. If you're feeling too sad, depressed after delivery, we are there. If you're not able to breastfeed and you're feeling guilty and bad, that oh my god, am I a bad mother, I'm not feeding my baby, I'm not able to breastfeed, you feel terrible. The mom guilt takes over, it's so big. I'm a working mother, and I'm often late at work. And every time I come home, I'm so guilty. You know what my fear is? I'll tell you. My fear is, what if my baby starts calling the baby caretaker mama? I will feel so bad if he calls her mama instead of me. That's my mom guilt. And I'm sure you will also have your share of mom guilts. And even in pregnancy, you will have 1 million doubts. But your doctor is your helper. They're there to help you. If she's angry on you, if you're not comfortable with her, then she's not the right one for you. ओके, सो चूज हर वाइजली. ऑल्सो एक पुरानी कहावत है कि जो आपके बच्चे को सबसे पहले अपने हाथ में पकड़ता है ना, उसके गुण बच्चे के अंदर आ जाते हैं. सो यू शुड डेफिनेटली चूज द गायनेकोलॉजिस्ट वाइजली. And in your journey, if you have any troubles, I am right there. Might not deliver all of you now or later, but I'm always there to help you. Okay, you can trust me on that. Just send me messages on Instagram or YouTube, and however possible, I will connect with you. I also do not take money for online consultations. I do charity in the name of my son. Charity of your choice or my choice. So it's that simple. So you can connect to me. I hope you liked all my tips. For further doubts, you can leave them in the comment and I'll try and answer them as soon as possible. Okay. Bye. It was lovely meeting you all.